Hello, my name is Aurora Sousanis, and my project is on the effects of poor sleep and sleep disorders in children diagnosed with ADHD. While ADHD can negatively impact the health and safety of these kids on its own, the associated sleep disturbances create a whole other set of issues and worsen ADHD symptoms. In addition, sleep disorders in children can often be misdiagnosed as ADHD. Around 7 million children in the U.S. have been diagnosed with ADHD. Sleep disorders are thought to occur in 50 to 80% of these kids. Before we get into it, it's important to note that ADHD and its association with sleep disorders are not a new concept, with observations of something labeled hyperkinetic disorder dating back as far as the 1700s. Then, in the 1950s, two scientists observed that the parents of hyperkinetic children are so desperate over the night problems that the daytime ones pale in significance. ADHD has been linked to many sleep disorders, including hypopnea or apnea, restless leg syndrome, peripheral limb movement disorder, circadian rhythm sleep disorders, and it's also associated with increased sleep onset latency, shorter sleep time, bedtime resistance, difficulty with morning awakenings, sleep-disordered breathing, night awakenings, and daytime sleepiness. While ADHD symptoms carry health risks on their own, the associated sleep disturbances create another set of health and safety problems. These include, but aren't limited to, an increased likelihood of developing dementia, heart disease, type 2 diabetes, obesity, and even cancer. What's more, as we learned in lecture, chronic poor sleep can also affect the ability to focus or stay alert for daily tasks like working or driving. These, combined with the increased distractibility of kids with ADHD, makes it very likely that they will experience a serious collision. Between 2017 and 2021, 17.6% of fatal collisions involved drowsy drivers. In many studies, it has been shown that people with ADHD are significantly more likely to experience all of the above, from heart disease to increased collisions, type 2 diabetes to obesity and even cancer. However, the studies that prove this don't mention the lack of sleep these patients also experience because of ADHD. It's possible that by fixing the sleep problems, many of the other effects and symptoms of ADHD could also be diminished or even solved. Currently, the U.S. guidelines recommend that children are evaluated for ADHD and at the same time are assessed for sleep apnea and other sleep disorders before being diagnosed, but there's no requirement. Children with ADHD are likely to have obstructive sleep apnea or OSA. There's some research that suggests that positive airway pressure ventilation in patients with OSA and ADHD may also be associated with improvements in ADHD symptoms. Weighted blankets, stimulant medications, routine sleep schedules, and weight loss have also been tried as possible interventions, but stimulant medication can go both ways, either significantly helping patients sleep or significantly hurting. In light of my research, I am suggesting several policy changes to the ways children are tested and treated for ADHD. All children who go in for ADHD evaluations will now be required to simultaneously undergo testing for sleep disorders to avoid misdiagnosis. If the child is accurately diagnosed with ADHD and is then prescribed stimulant medication to treat it, effects on sleep must be closely monitored. Treatment of ADHD will from now on include routine sleep schedules and sleep monitoring/tracking that will be shared with psychiatrists. Scientific studies of ADHD also need to take sleep deprivation and disturbed sleep into account as they continue to research this disorder. It should be noted that there are some barriers to this reform. More comprehensive studies are needed to better understand the link between ADHD and sleeping disorders. And because the relationship between sleep and ADHD is multidirectional and complex and not yet totally understood, it is difficult to create a one-size-fits-all solution or reform. To help overcome these barriers, therefore, increased funding towards ADHD and sleep research will be implemented, and patients, their families, and doctors will work together to craft a unique treatment plan with the help of individualized sleep tracking data. As discussed in lecture, however, sometimes sleep tracking can result in the onset of orthosomnia. To decrease the possibility of this occurring, the data from sleep tracking will be used primarily for psychiatrists to make recommendations and edit the treatment plan. My policy changes and research could have several important results, including reduced instances of ADHD misdiagnosis, reduced ADHD symptoms in patients, potential reduced prevalence of comorbidities such as obesity, diabetes, high blood pressure, dementia, heart disease, and cancer in older age, reduced fatal collisions due to drowsy and distracted driving, higher graduation rates, and reduced unemployment rates in people with ADHD as their ADHD symptoms are improved through better sleep. Thank you so much. Goodbye.